Welcome to Concussion Fix minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go. All right.
So I just wanted to ask, in terms of the exercise so maybe let me start with manual therapy. So, because I get a lot of muscle tension and also tiredness, so I'm just not sure what's the best way to approach this. I'm going to chiropractor. I mean, originally, I think I messaged you. I had an anxiety after the first chiropractic appointment. So I was wondering if this is for me or not. I noticed positive mobility changes in my spine. So now I'm going to chiropractor 2 times, and I'm getting addicted to it a little bit. But it also makes me a little bit tired. I mean, every time I go, it's maybe a little bit less and not so much as when I started, but still I get a little bit of tiredness after the adjustments. So I was just wondering how to tackle that with the exercise. And I don't know, maybe it's also because there was December, and I think normally it's very tiring month for me and probably for everybody. And but I just noticed that I'm getting quite tired, especially after the exercise. So I was just wondering, is it better, let's say if I have a chiropractic appointment, and then is it good to do the appointment, the exercise on that day, or it's better to skip it, for example, and do it the next day? So that's maybe my first question. And then the second question, if I do exercise on one day, I see that next day I'm a little bit more tired and I get muscle tension after the exercise. So is it good to basically push through this tiredness and exercise the following day, or give it a day break and exercise every other day?
You can do it on the same day. There's nothing wrong with that. And I think that if you just do that and get into that routine, I mean, that will help with the fatigue as well. You'll get more energy from starting to improve your exercise tolerance. But also if you have an appointment on a day, I would do your exercise before the appointment so that you're not struggling through the exercise after the appointment. Now, the fatigue that comes from treatment, sometimes that's, related to, inflammation from somebody working on your muscles. It also is related a lot of times to kind of anxiety or a sympathetic response. So that if you're going in there a little bit nervous about getting treated and then they treat you, that can kind of send your body into a bit of a fight flight, and that can just kind of wear you out, right? So if you're kind of in that heightened state of arousal, it's going to just be fatiguing. So, try working on some strategies while you're doing the appointment, before you're doing the appointment, and maybe doing some exercise before the appointment would actually be helpful because you're able to warm up the tissues. They tend to respond better when they're warmer. It also, exercise is, relaxing, and it helps to increase your parasympathetic side. So it helps to reduce stress. And so maybe that's routine. Try that. Try exercising prior to the appointment, and try doing things, during, before, and after to try and just keep your sympathetic nervous system from activating. And then obviously continue working on all the other pieces like diet, autonomic, mindfulness, all those things to try and keep things balanced.
Okay. And also, are the chiropractic appointments, is the chiropractic care enough? Or because I think you mentioned about that, there should be soft tissue and, for example, the joints, and that you have to approach it holistically. So I'm just wondering, because I'm doing now only the chiropractic care. So I'm just wondering, am I missing something? Should I add something into this kind of
I don't know what
treatment?
I don't know what they're doing, right? Chiropractic is just a professional title, right? So that's like saying, is doctor enough? right? Well,
Okay.
what is the
Well, they do
doctor
just like
doing? Like,
bone.
it's the
Yeah,
same
I
thing,
mean, they
right?
do just like the kind of adjustments. I mean, it takes like, I don't know, maybe 5-10 minutes
Yeah.
sometimes.
No, that's not what you're looking for.
Okay.
So soft tissue is
So.
probably more important than the adjustments. Right.
Mm-hmm.
So anyone who's just doing adjustments, sometimes that will help to relax soft tissues, but ideally you want to do the soft tissue work before you do the adjustments anyway. So like I typically will do soft tissue, acupuncture, get things loosened up and moving well, and then if there are
Mm-hmm.
any things that I can adjust, I'll look and be like, okay, maybe I'll do an adjustment here or there. But I have a lot of patients that I don't adjust at all because the soft tissue is really the most important piece anyway. So if they're only doing adjustments,
Mm-hmm.
that may not be sufficient. So you may want to, overlay that with something else. If you have a physio that does manual or a massage therapist, you can kind of alternate between the two, so that
Mm-hmm.
you're getting both pieces.
Yeah. Now I'm just wondering. I mean, in the Netherlands, we have something called manual therapy, which, but I think we are kind of getting lost in translation, because I think what manual therapy means in like Canada is something different than what is manual therapy in the Netherlands. So I'm just a little bit lost. Like, what should it be if like the
Go
chiropractic is doing the
go look
adjustment?
go look at the two videos I did. Go to the resources portal.
Mm-hmm.
Go to my live presentations and look up. I have a manual therapy part 1 and a manual therapy part 2. Watch
Mm-hmm.
both of those, and I actually go through like me treating somebody where you can actually see what are you doing, and you
Yeah.
look at that,
Yeah, I
and then you
watched that.
say, "Am
I
I
just
getting that or not?"
hmm Okay. Yeah. So, what are some of the questions? Because I saw that video. It's just I don't know how to find the right specialist that would do that. So, are there maybe some questions that I could ask them, or like just
You
I
could
don't
ask
know,
them.
because it's
Yeah, you could ask them
hmm
if they do soft tissue work. Right? Do you work
hmm
on the muscles or do you just do adjustments?
hmm
You could a lot of times you have to go in and maybe try it and talk to them and be like, is this
hmm
really, is this what I'm looking for or not? Um, I don't know if there's many people that are certified in active release over there, but you can
hmm
go to the active
I
release,
haven't seen.
go
hmm
to the activerelease.com website and see if you can find any trained providers. That might give you a clue. Uh,
hmm
so
Yeah,
yeah,
I saw
it's tough.
osteopaths. There's a number of osteopaths that have like some treatments for whiplash or
Sure,
sometimes concussion. Would
sure.
that be perhaps more
Yeah, a
suitable
lot
for
of this
them?
stuff this is the most challenging thing because a lot of this stuff is just trial and error. So
Mm-hmm.
we try to point you in the right direction. So if you go and watch those videos and be like, okay, this is kind of what I'm looking for, and
Mm-hmm.
then start looking around, asking other people if maybe try osteopathy, okay, they're not doing the thing I need, so I'm going to try this, manual therapy person. They're not doing that either. Maybe I'll try massage. Oh, this is pretty good. Okay, I'll stick with massage, and also maybe I have some joint issues. I'll do chiro and massage. It's really just trying to figure out who is gonna help you, and there's no real kind of set parameter for that. Like if you look on their website, look for people that treat headache disorders, right?
Mm-hmm.
Because that generally means they're pretty proficient with necks. Go to the activerelease.com website and see if you can find a provider in your area, and then look at their website. Do they treat headache disorders? It's a lot of trial and error. But if you look at those
Mm-hmm.
videos again, just kind of rewatch them and be like, hey, this is what I'm looking for, this type of
Mm-hmm.
thing. It doesn't have to be exactly what I do. Like, I'm gonna have a different style than different people, and it doesn't mean that those other styles don't work. But you just want to have somebody who does soft tissue as well as adjustments. And if you can't find that, find somebody who does massage and soft tissue, and then find somebody who does the adjustments, and you just alternate between the two.
Okay. Mm-hmm. So for now, would you say it's better to stop with the chiropractic, because it
No,
kind of
no,
makes me feel good as well?
great.
But I'm just thinking maybe, yeah, I should
No,
add
no, don't
something to it
stop. No, don't stop, but just find a massage therapist to do the soft tissue work so
to
that you're getting
combine the
both.
two.
Yeah,
Okay.
yeah,
Okay, I will do that. I will look for somebody. And
okay.
just to finalize on this tiredness, like, is tiredness a normal part of concussion, and that goes away with time or with exercise or with, I don't know.
Yeah. So fatigue can be related to a whole bunch of different things,
Mm-hmm.
right? So you can't just say like, is tiredness related to the concussion or not? Because tiredness could be related to autonomic dysregulation, like I mentioned. It could be related
Mm-hmm.
to inflammation. It could be related to hormone issues. It could be related to sleep dysfunction. It could be related to even people with neck dysfunction have increased fatigue levels and poor sleeping. So it could be
Mm-hmm.
related to your neck. So getting the neck treatment may help with that over time too. Um, so you kind of have to do all the
Okay.
things. That's why. But if you're doing all those things and you've balanced your autonomics and your inflammation is low and you're exercising regularly and you're sleeping well and you're getting your neck treated, all of that will fall into place. Right. So
Mm-hmm.
we don't typically go after symptoms in this program. Like it's not like, okay, fatigue, you need to do this one thing, because all the
Mm-hmm.
symptoms overlap with every single one of those categories. So it's impossible to try and pinpoint which one of those categories is your issue. That's why we address it in that stepwise way, and we make sure we're addressing all the underlying potential causes for any of the concussion symptoms. And as those
Okay.
things get better, those symptoms will improve.
Mm-hmm.
Fatigue is
Okay.
such a
Yeah.
huge part of mental health challenges and
Right. There's another one.
anxiety and depression or stress. Fatigue really is a huge part of that. So right at
Right.
that foundational
Mm-hmm.
component of our concussion fix pyramid is looking after our mindset and our mental health and our well-being, right? When we're anxious all the time, our body's tired because we're in a constant state of fight or flight. We're in that constant
Mm-hmm.
sympathetic activation, right? Our nervous system is dysregulated. So that's even that foundational one that can contribute to fatigue, and alongside everything else Dr. Cam mentioned. So kind of delineating for yourself, hey, what could this be? Is there some value in going back to some of these modules more at the beginning of the program to help support? Or maybe you can
Mm-hmm.
point it yourself, right? And recognize, fatigue is also part of getting an adjustment if you get that fatigue afterwards. Like Dr. Cam said, it does activate your sympathetic nervous system, so it can generate fatigue afterwards. So it is a bit of a puzzle.
Mm-hmm.
Not always clear.
Yeah, exactly. Okay. Thanks a lot. I think that answers my question.
Good luck.
Yeah.
Thank you.
Keep peeling the layers, and hopefully we'll continue to find what's driving that fatigue. But overall, it's a combination of multiple things in our experience usually.
Okay. Yeah. Thanks.
Thanks for listening to this Concussion Fix minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.